Hey everyone, Ryan here, and welcome back to our Head and Neck Anatomy series of videos. This video will be about the fossa of the skull. A fossa is a depression in bone that houses several contents, things like nerves, blood vessels, and muscles. And we'll focus mostly on the fossa on the outside of the skull. That's because that's what board examiners tend to ask about most. So the first three are the external fossa. I'm going to be talking about the temporal fossa, infra-temporal fossa, and pterygopalatine fossa. And as we go down that list, these are going further and further into the skull. They're also getting more and more complex. And then we'll finish up this video by briefly covering the internal cranial fossa that accommodate the brain. So we're going to start with the simplest and most outside of those external fossa, being the temporal fossa. Here we're looking at the lateral surface of the skull, and this dashed line demarcates where that temporal fossa is located. The superior border is determined by the superior temporal line, as well as the posterior border, also determined by that same superior temporal line. And the temporalis muscle actually originates from that line on the skull. The inferior border is determined by the zygomatic arch down here. The anterior border is determined by the frontal process of the zygomatic bone. The frontal bone also contributes a bit to that anterior border right there. The floor, which is what we're staring at here, is composed of four different bones, being the frontal bone, greater wing of the sphenoid, here in yellow, the parietal bone up here in green, and the temporal bone down here in pink, specifically the squamous portion or flat portion of the temporal bone. The contents within this fossa are, of course, the temporalis, which again originates from that superior temporal line, the superficial temporal artery, and the auriculotemporal nerve. So everything sharing that word temporal. And these latter two items are things that supply and innervate the temporomandibular joint. All right, so let's do some drawing to help remember this. If you have some markers or colored pencils, feel free to draw along with me here. So what I really like to do to help memorize things like this is to simplify the shapes as much as humanly possible while still making sense. So in this case, we're going to start by drawing a rectangle. So we're going to make this rectangular shape, and what we're going to do is draw a plus sign and break this rectangle up into four unique quadrants. The top left one we're going to label frontal. That's going to be the frontal bone of this drawing. The bottom left we're going to call the sphenoid. The top right we're going to call the parietal. And the bottom right we're going to call temporal. And so if we want to match these colors here to be with what's going on in the picture, we're going to make this one our light blue. We'll make this one our light green. We'll make this one down here in yellow. And we'll make this one in pink. Because what I think more important than having the exact shape and the exact weight that all of these bones contribute, it's a lot easier to just remember a rectangle with four quadrants and what bone is in what orientation. So we can label this drawing a little bit more. At the center, where all four of these bones meet, is called the pterion. We talked about this in a previous video. This is a very weak part of the skull. That's because it is a junction point of 4 separate bones, and the middle meningeal artery runs right beneath that. As far as the borders, we talked about the superior and posterior border being the superior temporal line. So both that and that border are determined by the superior temporal line, or STL. And then the inferior border and anterior border are being determined by this zygomatic bone. So this is the zygomatic arch. This is the frontal process of the zygoma. So the zygoma is placing those borders for the temporal fossa. And there you go. That's really all of the high yield facts that you need to know for the temporal fossa, as well as what it contains. So let's move on a little bit deeper and travel a little bit deeper into the skull to the infra-temporal fossa. And now we essentially sectioned out that zygomatic arch so we can get a better look at what's going on. We've also removed the mandible from this drawing. So now we're a little bit more intimate. The space is a little bit smaller. The lateral border is determined by the coronoid process and the ramus. So you might remember the last temporal fossa, we didn't have a lateral border because we were just on the outside of the skull. But now, since we have to section all this bone away, we're essentially getting a look what's behind the coronoid process and the ramus, which would be sticking up in this area. So that's the lateral or outside border that we've peeled away from this drawing. The medial border is the lateral pterygoid plate, and that's what we're staring at right here in yellow. So that's the inside border, the inner bound of this fossa. The superior border is the greater wing of the sphenoid. Specifically, what I'm pointing at right here is the infra-temporal crest. The inferior border is not shown, but it's mostly determined by actually a muscle this time. So the medial pterygoid muscle runs down through here. It attaches at the medial angle of the mandible, and that is basically determining that inferior border. The anterior border is determined by the posterior surface of the maxilla right here. The posterior border is determined by the condyle as well as the styloid process and the articular eminence. So all of these bones of all these features of the temporal bone as well as the condyle itself are creating this posterior border of the infratemporal fossa. Here we have a lot more content. We have all of the muscles of mastication are moving through this space. They're occupying it to some degree. The pterygoid plexus of veins, the maxillary artery, the posterior superior alveolar nerve, the mandibular nerve, which includes the inferior alveolar nerve, the buccal, auricular temporal, and lingual branches, the chorda tympani of cranial nerve 7, as well as the otic ganglion. And don't worry, all of these things, all of these contents, we're going to cover those in future videos. So we're going to have a video about nerves, we're going to have videos about arteries and veins, and all of that will be coming up very, very soon. All right, so again here, I have another drawing for us. So let's return to our pen. And this time we're also going to draw a rectangle. And you'll have to excuse me, I'm using a tablet, so my lines aren't going to be all that straight, but I'm trying my best here. So that is our infratemporal fossa. Of course, again, it's not a perfect rectangle. This is not a perfect rectangle, but that's okay. We don't need to remember that specifically. We just need something to help us remember the general orientation and borders of this fossa. So what we're going to start with first is actually the lateral border, what we had to peel away. And that is the coronoid process, which would come up kind of like this, and we'd also have the condylar neck, and the condyle would be maybe something back here, and then the ramus would extend down this way. So that is what has been removed so that we can get a look at what the infratemporal fossa actually looks like. The upper bound is the infratemporal crest. That's that part of the sphenoid bone that kind of sticks out up here. So that's the infratemporal crest up there. In the front, we have the maxilla. The posterior surface of the maxilla right here is determining our anterior border. The medial pterygoid muscle is running down this way. And then we have the condyle, so the condylar process, as well as the styloid process. That's this part right here of the temporal bone, is creating that posterior border. All right, and so we can use a couple of colors to add here. This pink is for our temporal bone, just like it was the last time. We have this dark green for the maxilla, so that's contributing to this anterior border. And then of course we have the medial border, which is essentially the floor of, from the last drawing, the floor of the temporal fossa was what we were staring at. So the medial border is kind of what we're staring at here, being the lateral pterygoid plate. And so the lateral pterygoid plate kind of comes down like this, and it has these bat wings, and then it comes up again like that. So that's our pterygoid plate determining the medial border. So that's our infratemporal fossa and all of the contents within it. So a lot going on here, but if we simplify it, it's not so bad. For the last external fossa, we're going to actually zoom in and go even deeper into the skull. And we're going to zoom in on this teardrop shape that happens right here between the maxilla and the lateral pterygoid plate. And that's the Pterygopalatine fossa. So why do test examiners like this fossa so much? I'll be honest, it comes up all the time in dental school and on dental board exams. And the reason is it's the main communication hub. There's a lot that goes in and out of this fossa, and there are all these important nerves and arteries and veins that we're all taught to memorize, and a lot of them happen and move through this fossa. So this is a really helpful table that I put together, and it lists out the borders, and we can go through those first. We actually don't have a lateral border per se because there's no bound there. We're just staring straight in, and I guess the closest thing you could call to a lateral border would be the infratemporal fossa. That's where we just were, and we've traveled a little bit deeper into the Pterygopalatine fossa. So those two are just in communication. They're continuous with one another. The medial surface, that's what we're going to be staring at back here in this dark blue. That's the perpendicular plate of the palatine bone. The superior border up here is once again the greater wing of the sphenoid. Same thing that contributed to the superior border in the last fossa. The bottom, the inferior border of this fossa, is determined by the pyramidal process of the palatine bone, once again in blue, that dark blue color. The anterior border, once again, is the posterior surface of the maxilla. So again, that's also the same as the infratemporal fossa. The posterior border is the pterygoid process of the sphenoid bone. So the pterygoid process is the part that supports the two plates, the lateral plate and the medial plate that stick out posteriorly. And that makes sense because, again, we're zooming in on this teardrop, and so the maxilla was out in front, the pterygoid plate was behind that teardrop, and so it makes sense that the anterior and posterior borders match with that. Now, each of those borders has an opening within them, and those openings translate and transmit, I should say, certain contents through those openings. So we're actually going to do our drawing now. So you can get your pencils and pens and markers and things out once again. And this time we're not going to draw a rectangle. We're actually going to draw a cube. And that's because, just like a cube, there are 6 surfaces that we have to think about in this case. So let's draw the top of the cube, the side of the cube, we have the front of the cube, and then I'm actually going to also go ahead and get a little fancy here and draw these dashed lines. Now, what I'm also going to do is, since, again, we have the outside of the hole peeled off, there's no lateral border, so we can actually see straight in here. So I'm going to make these solid lines. I'm going to make these solid lines here because we can actually see into this hole and see what's going on there. I'm going to leave the dashed lines right here and here because we can't see through these 2 walls, which are solid. This wall is not solid. We can see straight in here because that is our main opening, which is called the pterygomaxillary fissure. The pterygomaxillary fissure is that teardrop shape that I called you. That's the name of the hole, that big opening that we're just looking into right here. That opening transmits the PSA nerve as well as the maxillary artery. They are going into this opening right through here. All right, let's go to the medial surface next. So that is going to be this wall right here. That is, or I'm sorry, the medial wall is going to be this wall on the back side of that cube. And so let's get our dark blue color. That's for the palatine bone. And so we can color this in dark blue. And I'll leave these dashed here. And we'll color these surfaces in like that. And this is the perpendicular plate of the palatine bone. And this surface has one opening, the sphenopalatine foramen. So the sphenopalatine foramen opens up towards the back. It's actually this little hole right here that you can barely see. And the sphenopalatine foramen is the opening into the nasal cavity. It's the opening into the nasal cavity. So sphenopalatine foramen. And into the nasal cavity travels the nasopalatine nerve as well as the sphenopalatine artery. The superior surface is up here, and the superior surface, again, is the greater wing of the sphenoid. This one also has one opening, and it's the inferior orbital fissure. So this one opens as the inferior orbital fissure, and it opens into the orbit, into the house for the eye. So that's the inferior orbital fissure. And into the orbit travels the infraorbital nerve and artery, as well as the zygomatic nerve. The inferior border is, again, part of the palatine bone. So I'm also going to color that in blue. And hopefully you can start to see how this is making sense. Those 2 blue bones contact together in this kind of L shape. And that is what the palatine bone does. It actually makes an L on the right and also the left. So that's that L shape that we're looking at right there. And the inferior border has one hole as well. This one is the greater palatine canal. The greater palatine canal is going to open into the oral cavity. So you can start to see how this is really a communication hub that's between all these different important spaces in the skull, the orbit, the nasal cavity, the oral cavity, and we're not quite done yet. So let's go back and color in our superior surface, which is the sphenoid bone, in yellow. So we'll get that colored in up here. And then I'm just going to add really quick, we're just going to add a little arrow out this way. This is our pterygomaxillary fissure, and that leads to the outside of the skull. That's headed towards the infra-temporal fossa. So outside pterygomaxillary fissure. All right, so we only have 2 more to go. The anterior border is the maxilla. This one's nice and easy because it doesn't have any openings. So we're just going to color that in green to match our maxilla bone over here. All right. And then we finally have one last that I've saved the best for last because it has the most going on, and that's the pterygoid process of the sphenoid bone making up the posterior border. So here, we're going to color this in yellow, and you can see how the 2 yellows contact together to form their own L, and that makes sense as well because you have the greater wing running up here, and then the pterygoid plate which sticks out down like this. So that all makes sense as well. So we have the 2 yellows contacting each other, the 2 blues contacting each other, and then the maxilla off to one side, and then that opening into the whole cube. The posterior border has 3 openings: the foramen rotundum, the vidian or pterygoid canal, and the pharyngeal canal. And each of these transmits something different. So we're going to make 2 unique arrows because this back posterior surface opens into 2 unique cavities. The cranial cavity, where the brain lives, is reached via the foramen rotundum and the vidian or pterygoid canal. So foramen rotundum transmits V2, the second division of the trigeminal nerve. The vidian canal or pterygoid canal transmits the vidian nerve or the nerve of the pterygoid canal. So those names perfectly line up with one another. So both of those are going through the cranial cavity. And lastly, the pharyngeal cavity is communicating with the nasopharynx. So that's behind, posterior to the nasal cavity, which again makes sense because we have the nasal cavity there, the nasopharynx is posterior to it. So the pharyngeal canal transmits the pharyngeal nerve and artery into the nasopharynx. So all of those names match up with one another, and that's about as simple as I can make this Pterygopalatine fossa. There is certainly a lot going on, but hopefully this cube and this breakdown of what's going on makes a lot of sense and can help you memorize this stuff. I just thought it was really interesting and helpful to remember that this truly is a main communication hub. It's the center of the skull because we're communicating with the orbit, the oral cavity, the nasal cavity, the cranial cavity, and the nasopharynx. So we're just getting to all of these different inside parts of the skull through this one opening within the skull. So I think it's just so cool. And again, hopefully that really does help you in your studies. Here's just another way to look at what we've just looked at, that teardrop opening, and we have all 6 different holes to talk about, those foramen and which, and then you can refer back to this table in terms of which nerves and which arteries are traveling through each of those and what cavities we're able to get to through each of those 6 openings. All right, and lastly we have these internal cranial fossa. And so the floor of the cranial cavity, this is the same drawing we looked at for the foramina video. This floor is actually divided into 3 distinct depressions or fossa: the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. So the anterior one is made up of the frontal bone, the ethmoid bone, and the lesser wings of the sphenoid bone. It lies over the nasal and orbital cavities. It houses the frontal lobes of the brain. The frontal lobes of the brain sit in this fossa. The middle cranial fossa is formed by the body and the greater wing of the sphenoid, and the squamous and the petrous parts of the temporal bone. It accommodates the pituitary gland right here at the center and the temporal lobes of the brain at its sides. The posterior cranial fossa consists mostly of this occipital bone and a little piece of the temporal bone. This one accommodates the hindbrain, being the brainstem and the cerebellum. All right, that's it for this video, guys. Thank you so much for watching. Please like this video if you enjoyed it, and subscribe to this channel for more on dentistry. If you're interested in supporting this channel and what I do here, please check out my Patreon page. Thank you to all of my patrons here for their support. You can unlock extras like access to my video slides to take notes on, and practice questions for the board exams, so go check that out. The link is in the description. Thanks again for watching, everyone, and I'll see you in the next video.